Hello, welcome to Healthy Talk, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and today I'm excited to have Ethan Patterson, physical therapist and the Director of Rehab Services here at Boone County Hospital. Later in this episode, we'll also be joined by Carolyn Siskoff, physical therapist specializing in pelvic floor and women's health. But let's welcome Ethan right now. Welcome, Ethan.
Hello.
Let's start with a little background. What got you into physical therapy in the first place?
Well, when I went to college, I initially went for pre-medicine, so I thought I was going to be a doctor. And then I spent quite a bit of time shadowing at the CVICU, the Cardiovascular Intensive Care Unit at the University of Iowa Hospital and Clinics. And I realized in my time there that I didn't really see a doctor almost at all. And so I realized that the doctors maybe don't get as much time with their patients as I thought they did. So I was kind of thinking of what I might want to do. And my mom was getting physical therapy at the time, and she was like, "You like exercise? Why don't you try physical therapy?" So I went to a physical therapy clinic in Iowa City, and the guy that I was shadowing there, all the patients, he knew them. And he was like, "Oh, I saw your kid at the game last night. He did great." And, you know, you see your patients multiple times a week. In the inpatient setting, sometimes we see them every day or twice a day. And so you get to really know your people, and you get to really build relationships and change lives. And so that's why I decided to become a physical therapist.
That's fantastic. So that personal connection is really important to you. We've also talked with other doctors, and they've talked about also how important that shadowing is. Any occupation, I feel like it's good to get an idea of what it is, because you have one way in your mind and then it can be completely different. So that's great that you were able to do that and figured that out and now are doing something that you love. So what led you specifically to Boone County Hospital? And you've stepped into this new leadership role.
Honestly, what brought me back to Boone was my dad was sick and my family's from Boone. I was born and raised here. So I came back with my wife after we graduated to help take care of my dad. And I took a job here, honestly, because it was the job that was available, and it was doing home health and inpatient physical therapy, which was not at all what I was interested in. Yeah, every boy who wants to be a physical therapist wants to be like a sports physical therapist. Sure. That's kind of what my dream was. And then I just came here and I took the job that was here and ended up actually really liking inpatient and home health. Then down the line, now here I am, and I do a little bit of everything now. So I see outpatient, home cares, inpatients, administrative stuff. And I will say that I'm very excited to serve in this role because I came back here in part to be back in the community that I was raised in. And it's really cool to be able to provide this kind of service for people, the community.
You know.
Yeah, people I know, the community that I love and that raised me, and see people all the time that you know, and you can make a difference in their lives. And after you get a certain age, there's only so many things that people know to talk about with you. And so they'll always ask, like, "Well, where are you from?" And when I get to say, like, I'm from here, that actually makes a big difference to how comfortable people feel with you a lot of the time. And so I'm really excited to be able to do that. And then I'm really excited to be director here because we have such an amazing team of therapists that are just really delightful to work with, people that really care about patients. And that gives me a lot of opportunities to just listen to them and really grow and develop what we do based alongside what they want to do to get really good care for our patients.
How many PTs do you have? How many PTAs do you have? What's it look like?
For a small rural hospital, we have a lot of staff. We have 8 physical therapists and 3 physical therapy assistants or PTAs. Okay. They all have different specialties. They come from different backgrounds. We have Tony Mack has been here forever. I think he's turning 70 this year. We had a new therapist start who just graduated from the University of Iowa. So we've got the cutting edge and the tried and true. So we've got it all.
What are some of your big goals for your department?
The first thing, kind of like I said before, is listening to our staff. They know all the stuff that's broken and that's not working. They all have ideas to fix it. So I'm excited to be a new person to come do the things that maybe people thought, oh, it's just this way. It's just the way it is. And I think we've been able to do some of that already. And then I really want to bring students back into the clinic. We haven't had a whole bunch of physical therapy or physical therapy assistant students coming in and shadowing our staff. And I want to get back to doing that more frequently and more often.
Well, you just talked about how much just shadowing something made a difference to you.
Right. It made a huge difference in my life. And we've really got a special place here, and people are great to work with. It's a great community, and it's a shame that more people don't want to come work in a place like this. But also, I think it's in part because they don't know
exactly
what we have.
You just hear rural and think small.
Right.
But as we've talked about in these podcasts, we have so much to offer at Boone County Hospital. You don't have to go to Des Moines, which for Boone people is a drive.
Yeah.
You can get all you need right here.
Exactly. I think when people come here, they realize that it's special and they want to come back and they want to be a part of what we're doing here. Super important to provide that for people. And I think we're heading in that direction.
That's awesome. The physical therapy department just got kind of a facelift. What's new?
So we got new carpets. The walls just got painted. Actually, one of the things that a lot of the staff brought up was how cluttered the space was. So with the transition, we actually got to reorganize everything and make the space more efficient, make more gym space for patients to exercise in. And it's been really, really good.
That's probably one of those things that you were talking about, change. It's been the way it's been for quite a while. So it probably helps having some people who have been here for quite a while, but then you also having a fresh perspective, being newer here and being able to kind of combine the best of things.
Yeah, and new staff, they all have new ideas too. And they'll ask those questions like, why is this here?
Sure.
Like, it's in the way all the time. And you're just like, I don't know. Maybe we could put it somewhere else. And so it's been really nice to be able to feed off people's ideas in that way.
What of these new changes have you noticed that has impacted the patient experience?
It's a lot brighter in the clinic now.
That makes a huge difference.
It really does. And obviously what we do as a physical therapist and the exercises we prescribe matter, but so much of it's attitude and motivation. Yes. If you just come in and barely do what we say and you have a crappy time, you're probably not going to come back. You're probably not going to get better. So having a space that's welcoming, that's bright, that's inviting. Not only does it help the patient, but it helps staff be welcoming and inviting, especially when they think they have some ownership in the space. And
it's kind of like that first nice day of spring.
Yeah.
You go through all this winter and the first beautiful day, you're like, oh my goodness, I just feel so much happier.
Exactly. Yeah, and it makes a big difference. If you come into the clinic and you feel better than when you were at home, then you want to come to PT, yes. You want to do your exercises, and attitude has so much impact on if you get better or not. It does make a difference.
Okay, so let's talk about what you do. What kinds of physical therapy services are available at Boone County Hospital?
There's a ton. There's a lot we could talk about here. I'll start with just the fundamentals.
Sure.
Stuff is kind of the bread and butter of physical therapy. We do post-ops, so anytime you get a joint replaced, a rotator cuff repair, surgery on your back, anything like that, we're always there right beside you, getting you back to where you were before or better. Also, probably the number one reason anyone comes into physical therapy is because of pain. Back pain, neck pain, shoulder pain, knee pain, whatever it is. Maybe you don't know what's causing it, but you just know that you've got pain.
Wrong.
And maybe you've had pain for years and maybe it's just been a couple of weeks. But that's another thing that we help treat is just kind of that musculoskeletal or even nerve pain that people have day to day. We also work a lot with balance. As you age and you're less active, lots of people, their balance will kind of go downhill without them even noticing it. And then suddenly, you're falling over and you're tipping over all the time. We work a lot with that, and then just weakness. Same thing, whether you had an injury or the pain is causing the weakness or just getting older, people get weak and we help address those deficits. Beyond that, we have a bunch of specialties that we do that kind of get into the weeds a little bit. We have two great therapists that work with incontinence and pelvic floor and women's health. Carolyn's going to be talking about that. We also do vestibular rehab for vertigo. If you're feeling dizzy a lot of the time, we have therapists that can actually treat that. That's actually something you can treat pretty easily in PT. We also do TMJ, which is your jaw, having issues with eating or chewing. Lots of times we'll get referrals from dentists about jaw pain. We work specifically with Parkinson's. One of our therapists is specially certified in a program scientifically proven to help with Parkinson's, and so she does that, and she does awesome. One of our new therapists is very interested, like I was, in sports physical therapy. He's a certified strength and conditioning specialist, and he loves working with athletes, so we do that as well. And then me and another therapist do dry needling. That's, I think, all of the services we provide. There's a lot of things that we do, and that's just physical therapy.
So who can benefit from physical therapy?
All those things I list could apply to almost anyone, especially pain. If you have any pain, whether you're 18 or you're 50 or you're 90, probably physical therapy is a good place for you to go. And we can address most anything from dizziness to balance to weakness, the whole nine yards. So I think anyone could benefit.
What does a typical physical therapy session look like?
Again, this is going to be
depending
something
on
that,
what you
that
need.
Varies drastically from person to person. I would say with a general idea of something that we would do, obviously the first time you come in, we're going to have to evaluate you, try to find out what's wrong, where your deficits not just look at the symptoms like my shoulder hurts. Well, maybe your shoulder hurts because your back's not moving right. So we have to look at the whole system, not just treat the symptoms, but look for the root cause. And once we've identified that, then a lot of the time we like to do some sort of manual therapy, put our hands on the area to set you up for success with the exercises. Sometimes you try to do the exercise and you're like, ow, that hurts. But if we do some manual massage, or we get the joint moving better by physically moving it, or even do something like dry needling, it can set you up for success with the exercises, and then you follow up with the exercises to help that progress stick. So manual work to start to loosen you up, and then followed by exercise to help those things stick. And then you get to go home and you get to do those exercises on your own, and that's where the change is really made. There are patients that come in and they really need us to get them moving before they can do things on their own. So it is super important to come in, but if we get you moving good and then you go home and you don't get up until you come back, then you're not going to make the progress that you need. And we can't see you every day for an hour. So if we're seeing you 2-3 times a week, even, you got to be doing the stuff on your own to really make good progress.
Yeah. So physical therapy covers such a wide range of needs. And one area that has been growing significantly is women's health. Many women don't realize that physical therapy can help with postpartum recovery, pelvic pain, and even issues like osteoporosis. So to dive deeper into this important topic, I'm now joined by Carolyn Siskoff, physical therapist specializing in pelvic floor and women's health. Carolyn, welcome.
Thank you, Rachel.
Could you tell us a little bit about yourself?
I have been a physical therapist for almost 15 and a half years. I graduated from Iowa State University for my undergrad school and went to St. Ambrose University for my doctorate in physical therapy.
Let's start with the big picture. Women's bodies go through a lot of changes with pregnancy, postpartum, menopause, you name it. So how can physical therapy help women at different stages in their life?
I can work with patients with all types of urinary and fecal incontinence. I can work with patients with fecal constipation, pelvic prolapse, pelvic pain, dysmenorrhea, dysphoria, endometriosis, vulvar pain, pudendal neuralgia, and interstitial cystis painful bladder syndrome. I can work with patients through their entire course of pregnancy and postpartum, and I work with many different age groups from young adult all the way to the geriatric population.
Speaking of pregnancy and postpartum, what is something that physical therapists can do to support women during and after pregnancy?
Well, while a woman is pregnant, we can help improve their awareness of their core muscles and pelvic floor muscles, which can help reduce pain, especially in their low back, abdomen, and even pelvic region. We work with posture to help learn how to hold your body, carry the added weight that comes with pregnancy. We can help learn which muscles to kick in and use during labor and delivery to help make your body as efficient as possible. With postpartum, we can work again with the core muscles and pelvic muscles to help refine your muscles, wake them back up, and appropriately progress strengthening to get you back to all activities you may have been avoiding or unable to complete while you were pregnant. It's very common with childbirth, especially vaginally, but also C-sections. Your pelvic floor muscles don't work properly. They get overstretched, weak, or even tore during the process of delivery. During physical therapy, we can help make sure those tissues heal properly and you regain that strength back. Oftentimes, too, even with vaginal bursts, women feel they're normal, aren't having any incontinent issues. However, those muscles have physically gotten weaker, and your body just naturally doesn't kick them back in. So sometimes just a couple sessions can help you retrain those muscles to kick back in to prevent issues from happening 40, 50 years later. And oftentimes at the 6-week post-op check with the physician, your provider says, well, go to physical therapy. Your pelvic floor is weak. And they're sitting in front of me saying, I really don't know why I'm here. I'm not leaking. I'm not having issues. But they said to come, so here I am. And I'm like, you're the perfect patient because we can treat and strengthen before you have issues, and maybe you'll never have issues down the road.
Preventative.
Correct.
Would you say that there's lots of different things that you do if someone has vaginal delivery versus C-section, or is just depending on case by case?
It is slightly different. Vaginally, there can be just more trauma to that canal. So we may have to do a little bit more internal work to those pelvic floor muscles.
Do you have to be more cautious when going to PT after like a C-section?
Yep. Recovery with C-sections, longer to let that abdominal wall heal. It kind of is case by case as far as how much we progress. But most exercises initially are not stressful because we're really just trying to kick those core muscles back in. to strengthen.
That makes sense. I've heard a lot about pelvic floor dysfunction. How does PT help with that? And can it also help with conditions like osteoporosis?
For these conditions, sometimes muscles are weak and we need to strengthen. Sometimes they're also just too tight and we need to teach them how to relax. The pelvic floor is kind of the bottom of our abdominal cavity, and it needs to help support and hold our body up all day long. And it can run into issues during and after pregnancy, having surgeries. Even high-level athletes can have trouble because they've learned to hold their muscles too tight.
Sure.
And have forgotten how to relax to actually let the natural process of voiding and defecating happen. With osteoporosis, strengthening the muscles that are on the bones can help load your bones to help stimulate bone growth.
Okay.
As we age, we need more stimulation of our bones so that they don't get continually weaker and weaker, like it can happen with osteoporosis.
Sure. So you want to kind of strengthen those areas that could help prevent falling or something.
Correct. Also, too, with osteoporosis and the pelvic floor, it's important to have the appropriate amount of exercise. You can do too much or too little. Say you're holding your muscles too long and they get over fatigued, which can then lead to having more incontinence or more falls because your body's physically too tired to do the proper task. So that's where physical therapy helps prescribe the appropriate amount of exercise to do and when, just like a physician prescribes medication specifically, same thing with exercises. Some is good, more isn't always better, and vice versa.
I feel like there's so many women who assume things like incontinence or pelvic pain are just part of life, but it's not something that you have to live with, right?
Absolutely. I hate when I hear patients say that I've lived with this for 20 years or I just assumed it was normal. And I have worked with physicians around here a lot to ask the question. A lot of times women, we just go once a year for our yearly. We don't think about the fact that, we pee our pants when we sneeze or we laugh. And it was just a little bit occasionally and it's fine. And doctors don't think to ask that.
Right.
And so then the problem just goes unaddressed. And that's not normal at any stage in life.
Okay.
Aging does not mean you should leak your pants.
Okay.
And yes, the pain. It's not normal to have that excessive pain. Maybe we won't completely take away the pain, but we can probably help you cope with it and deal with it better. A lot of relaxation techniques can be beneficial. And oftentimes, a lot of what we do is patient education to learn our bodies better and listen to our signs and symptoms to minimize them.
Sure. Let's say someone's thinking about coming in for pelvic floor PT. What would they typically expect at their first visit?
Typically, with their first evaluation, I sit down and get a nice, thorough history of their problem, when it has started, even trying to think about past surgeries that they maybe think haven't been relevant but can. Then I look at their mobility through their spine, just active range of motion, look at their leg strength, and then I work within everybody's comfort level. Ideally, I do an internal assessment, vaginally and or rectally, but I can stay external and go through their clothes and get an appreciation for those muscles. There's 3 layers of pelvic floor muscle, so really getting a feel, is there increased tightness and tone that we need to teach them how to relax? Are muscles just weak? And kind of build off of that. I also like to look at their diet, their level of hydration, even the foods they're eating, medications that they're using, and kind of look at them as a whole person to figure out. A lot of incontinent issues are mental issues, that it's a behavior our body has gotten into the habit of doing, and we need to retrain our brain to listen differently to our bowel or bladder to fix the issue. One of the machines we have in physical therapy is biofeedback, and we can use sensors externally or an internal sensor to read the muscle activity of the pelvic floor. And oftentimes that is helpful It gives a visual graph on our computer screen. Patients can see, okay, I do a Kegel. Did I actually pull the muscles up and in like I thought I did? Or did nothing really happen on that graph?
That's fantastic, because when you do start doing Kegels for the first time, it is like, am I even doing anything?
Correct. Yes. Am I really using these muscles?
Yes,
or was it all my muscles
exactly.
and holding my breath? And you can put your pants back on, so it's just more comfortable. We can do it in any position. Can I hold a Kegel while I walk across the room? Mm-hmm. This graph will tell us. That's cool. A handy little tool to use. Also with constipation, we can put the sensor rectally. They do make those. I have them sit on the toilet with their pants up and see, can they actually relax and open their rectum and have a bowel movement? Oftentimes they're pulling up and in and not really using those muscles properly. So it's a great teaching tool to help with that.
People like seeing that visual, I'm sure.
A picture's worth 1,000 words sometimes. There also is electrical stimulation if people are really struggling with strengthening. Oftentimes we have to have several months of physical therapy before we'd even consider that, but it can help just promote stronger muscle contractions to improve that strength. Just another tool we have in our toolbox.
Would you say most of the people that come in for pelvic floor issues come in on their own or doctor's referral?
A little bit of both. Unfortunately, a lot of it, I think, is people, they've suffered long enough and are tired of dealing with it, so they're ready for something to change. Or they're trying to avoid surgery. The people that have pelvic prolapses in those early stages when they're really not noticing much of a change, maybe just a little bulge, if any. Those are the people we can be the most successful with to prevent surgery from happening. I think also, too, we're just increasing physicians' awareness of what we can do and being proactive at those yearly physicals. Well, I had my yearly physical and the physician said somebody could help you for this.
A lot of people hear pelvic floor PT and they think it's just doing Kegels, but it's a lot more than just Kegels, right?
It is. One, how you do your Kegels, how long you hold and how many you do depends on how strong your muscle is. I like to use the example, your bicep muscle. Some people can only lift 5 pounds. Why would I expect you to all of a sudden lift a 50-pound weight if you really don't have that muscle strength? So our pelvic floor are muscles, just like anywhere else in our body. So they do need to be addressed appropriately.
I did not hear anything, and nobody said anything till I was pregnant. And I don't even remember necessarily if my doctor said, oh, you should start doing Kegels, or if it was a find on social media when you're knee deep in pregnancies for the first time. So is Kegels something that you have people do when they're not pregnant as well?
Yes. Kegels can be appropriate at any stage in life. Usually, young adult age, we can certainly start doing Kegels. You know, the stronger those muscles are, the better.
And it doesn't just help for pregnancy, obviously.
Oftentimes, I hear people, even my 90-year-old population, they come in after a few sessions and, well, gosh, my tummy's gotten flatter. Because, yes, we're working those core muscles and learning how to use them better throughout your whole day. So, yes, we can flatten tummies and help get glutes.
It's so crazy how just a tiny muscle makes such a big difference.
Yes.
So what would you say are some of the lesser known things that pelvic PT can help with?
We can help with pelvic pain, prolapse, pelvic cancer rehab, and even menopause. So oftentimes the pelvic floor muscles in a chronic inflamed pain state are tight, and we need to teach that patient how to relax their pelvic floor muscles. Or even after having multiple surgeries and radiation and chemotherapy. Again, oftentimes those muscles are traumatized. So they're just really tight. There's scar tissue. So we need to help de-facilitate and, again, work in some relaxation techniques to get those muscles working properly. Oftentimes we pull in learning how to use our diaphragm and our core muscles really well to help get a normalization of just kind of, those core and pelvic floor muscles. With menopause, certainly the change in hormones and change in physical condition of the muscle and the tendons and ligaments all play a big factor into how well our muscles work. So we need to maybe change how we work with those Kegels, and maybe we can't be as aggressive, work in different positions to achieve the goals we want to have.
I've also heard that things like hip or back pain can also be tied to pelvic floor dysfunction.
Yes, our spine has our nerves that go and innervate into our pelvic floor muscles, and really starting from about your rib cage and below, those nerves can start to refer into your pelvic floor area, even your abdomen muscles, the front of your hip, the back of your hip, and your sacrum. And anywhere that a nerve is pinched or tight or inflamed can start to lead to issues elsewhere. So there's a lot of tie-in between how I hold my back, how well our pelvic floor works. If we're weak in our back muscles, core muscles, hip muscles, then that's going to put more stress and strain on our pelvic floor muscles. So that might make them work harder and not as efficiently. Also, if you think about people that have had a prolapse or tissue that is not as strong and thinner because of aging or menopause, then that's going to put extra strain on your low back or your hips and create some issues going that way too.
Okay, so kind of finding those root issues and helping clear up the pain from those.
Yes. And oftentimes, too, if traditional physical therapy hasn't been successful with working on your back pain or your hip pain and you just can't quite get that last little bit of pain, sometimes looking at that pelvic floor can be what really helps with that.
Going to see someone who specializes
Correct,
in that.
yes.
Now, we're fortunate at Boone to have physical therapists who do specialize in that, like yourself. Would you say that's common for a hospital our size?
I would say no, it's not common for a hospital our size to have. And we have myself and one other therapist, Rebecca Stemmel, also that treats the pelvic floor.
So not just one, but two.
But we have two. So yes, we are very fortunate.
If you had a case like that, then if we didn't have it, you'd have to go to
probably
Ames or Des Moines.
Or Des Moines, Ankeny, correct.
We like staying in Boone.
So we do like to stay local. Yes. And we are also regular physical therapists. So oftentimes we can kind of pick up on those things and switch our roles quite easily.
Yeah, we've talked about that when we interviewed Dr. Hayes about family practice, but then she's saying, she also does these specialties and OB. And personally, as a patient, I find comfort in one, that I don't have to go somewhere else to get additional services. And that person, you feel comfortable with that person.
Yes, that is very nice. And we have a great rapport with the physicians. So it's very easy if we have questions or need to communicate information. It's very seamless.
That's fantastic. For active women and female athletes, what kind of injuries or issues do you commonly see, and how can physical therapy help?
Oftentimes with active females, they have that high tone, increased muscle tightness. And so then your pelvic floor just isn't able to relax, and they may be leaking urine with high impact activities, exercises, or a lot of jumping. Oftentimes they don't address it because they assume it's normal. They have male coaches, so nothing ever happens with it. But no, that is not normal. Also could tie into having, maybe they have a overuse injury in their leg, their hip, their knee that has some weakness, and so then therefore is putting extra stress and strain on their pelvic floor muscles. So could be creating leakage or pain. It is very common to have that happen.
How about women dealing with chronic pain conditions like endometriosis or fibromyalgia? Is physical therapy able to help with that too?
We are able to help with those conditions. Working on relaxation techniques, stretching, massage, again, working up into their abdomen, their low back, their glutes oftentimes is very helpful. And then working at deep breathing techniques, just ways to try to reduce their stress and try to help ease their symptoms can be very beneficial.
What are some of the biggest misconceptions about PT for women's health?
Probably one of the biggest misconceptions is that you are never too old to retrain your bladder and bowels.
I could see a lot of people thinking it's just a part of my life, or it's just a part of getting older.
Correct. Yes, exactly. And it could even be they were leaking just a little bit 20 years ago, and it just kind of has gradually gotten worse and worse. But yes, they assume it's normal, and it is absolutely not normal.
It can be fixed.
It can be fixed, absolutely. We work a lot on education. We really want you to learn your bodies and your habits. Our bodies can be retrained. Oftentimes, the bladder has trained us when we need to go to the bathroom, but that shouldn't happen. We can train our bodies when we need to go.
Well, thank you so much, Carolyn, for sharing how specialized PT can be and addressing unique health concerns. At its core, physical therapy is about empowering people, helping them move better, feel stronger, and get back to living life fully. Whether it's a woman recovering from childbirth, an athlete returning to their sport, or a senior working on balance, physical therapy has the power to change lives. So with that in mind, Ethan, I'd love to hear about a success story that stands out to you.
One of my favorite patients kind of goes along with what I talked about earlier about now. I do outpatient, inpatient, home care. I do everything. So there's one patient that was in a motor vehicle accident and they broke their arm and both their legs, and they weren't allowed to put weight through that arm or either leg. And they were a younger person, and so they wanted to get back to it, and they weren't inpatient. They were skilled. They stayed here in a skilled bed, and they were here for 2 or 3 weeks, and we got to work on just getting out of bed with their spouse. Can they do the transfers, just bare minimum that they need to survive at home? And eventually they got to go home. And then I was the therapist that went out to their house for a couple months to actually get him from bedbound to walking again. And then once he was walking again, then he came outpatient, and I'm the therapist that gets to see him outpatient. And I'm still seeing him now. It's been over a year. And now he did a 12-inch box jump, and he can run at like 8.5 miles per hour for a minute and a half, which is just a huge deal for him. It's just super rewarding. And like I said, it's rewarding to build those relationships and work with someone. And something that's really special about Boone is that we get to provide care at all those levels.
Yeah, you're seeing him through the whole thing.
And that makes such a difference to him because he feels like he can trust me because I know the whole thing that he's been through. I haven't just read it in a report.
Right.
And so it's been really cool to be able to work with them and get them back to be able to run more and work out more.
That's so fantastic. That's got to be so rewarding.
Yeah.
Would you say that is your favorite part of your job, seeing those transformations?
I would say those skilled patients that we work with in the hospital 2 to 3 weeks at a time, we see them twice a day for sometimes hours a day. It's so rewarding to see them go home.
Do you see all skilled care patients? Because we just had Addison Enns on to talk about skilled care. She said they had to have physical therapy and another one in order to be even considered for skilled care. Is that right?
So when we're talking our medical surgical floor, we see the inpatients there, we see the observation patients there, but they're not really there for us primarily. They're there for the doctors. With the swing beds, those patients are actually there for the rehab. So they see us with PT and they see OT as well. They'll sometimes see speech if they need it. And really, the reason they're here at the hospital is to get better to go home because they can't walk or they can't transfer. It's not safe for them to go home. They don't want to go to a nursing home. They want to get better and go home.
They have a goal too, which helps probably.
It helps a lot.
They want to be able to get to their own house, live on their own. Exactly. They need you to get them there.
Yeah, and so that's super rewarding because that's probably where we see the most dramatic changes a lot of the time, where someone's barely able to do anything, maybe can't even stand, or maybe can't even like stand up and pivot and sit down in a wheelchair. And then we get to see them all the way through to when they can actually go home and take care of themselves. So that's really rewarding. And I'll also say my job as director, I get to work with our staff in a similar kind of way where I get to see their problems and problem solve, and I get to see them and work with them every day and make a difference in their lives and how they practice. And that's really rewarding too. It's hard to beat the transformation of seeing a patient go from like not being able to walk to being able to run again, but it is really rewarding to get to work with our team as well.
For those starting PT or maybe thinking about, maybe I should go see a physical therapist, what advice do you have to help them get the best results and get started?
I think that a lot of the times we live in a reactive society where you feel like you need PT after you've fallen, or once you can't get out of your chair anymore, or after the injury happens. But really, we can be pretty proactive with physical therapy if we want to. And maybe it's your 70th birthday and you realize I haven't been as active as I I used to be. Maybe now is the time to start PT and get a plan in place so that you can maintain your health instead of falling and breaking your hip.
Not waiting for that accident that you need it.
Mm-hmm. That's what I would say is people could be a little bit more proactive. People don't always think of physical therapy that way as something to do when things aren't terrible.
Right.
But I think that would be a great time to start thinking about it. Oh, your shoulder starts to hurt? Okay. Well, if it doesn't go away the next couple days, maybe then's when you go into therapy instead of in a month when you've got a full thickness rotator cuff tear. Now, sometimes physical therapy won't get you all the way back at that point. So you might need surgery and then physical therapy. So yeah, that's what I would say is just be proactive. You're always welcome to call into our clinic. Our front desk staff is great. And if you can schedule an appointment right then, you can schedule and come in and we'll see you. And if you don't need physical therapy, we can say you don't need, you're good.
That's the best thing you can hear, right?
Yeah. Or maybe it's just you need a couple exercises to do at home and we can give you a home exercise program and send you on your way. It can be that simple. Another thing would be you could ask your primary care doc if you've got any concerns. Do you think physical therapy would be good for this? And if they do, then they'll send us a referral and we'll call you and schedule it. So
people often think that you need a doctor's referral before seeing a PT, but in Iowa, that's not always the case, right?
Depends on your insurance. And so that's where our front desk staff is going to be really helpful. Lots of private insurance, it doesn't matter. You can come direct access to a PT. But if you're on Medicare, then you definitely would need a doctor's referral. You can always call and ask to be safe, but obviously anytime we get a doctor's referral, we'll see a patient no matter what.
For someone who's scheduling an appointment, how long would they have to wait to be able to come meet with one of the physical therapists at
Yeah, that's a great question. We always want to make sure that if we're taking you as a patient for an eval, that we have time to treat you afterwards. So we're not just going to evaluate you and then say, sorry. So generally our wait time has been, depending on how acute your diagnosis is. If you call in and you're like, I have 12 out of 10 pain, we'll really try to get you in soon, but no longer than 2 weeks to get in based on your diagnosis. And if you're proactive, like you have a total joint or something, you'll have a therapy session probably that day or day after your surgery because we'll get that in ahead of time and get it planned out and scheduled.
Do you have any final thoughts for our listeners?
I would just want to reiterate that physical therapy can be preventative. And I think that's where we're at our best is when we're preventing accidents and working with the community to avoid disasters like falling. Falling is terrible and surgery is hard. So if we can be proactive and notice the first time you fall or the first time you realize it wasn't as easy for me to get out of that chair as it used to be. Let's get therapy called in right then and let's get on top of it. Not that we don't love helping people from ground zero back to it again. We do, and we do those things, and people have a lot of success. So I guess on the other end of things, like don't ever think that
you're too far gone.
A lot of people think that, and I've worked with lots of people who had kind of given up, but with the expertise of a physical therapy team and the extra encouragement and accountability and support, lots of people can make really drastic changes in their quality of life. So that's why I would say you're never too far gone. Don't be afraid to ask for help, even when it feels hopeless.
Thanks so much, Ethan. That was great advice, great topic. Loved listening to everything you had to say. Thanks to everyone who was listening today. If you want to learn more, you can visit our website, www.boonehospital.com, and search for Rehabilitation Services. You can also call 515-432-7729.
Right on.
That's it for today's episode of Healthy Talk. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.